Start.
Good evening, everyone. My name is Aniket Biswa. She's my aunt, and beside her is my grandmother. So we are from Shillong. My grandmother suffered from a stroke in the 90s, and from then she's been paralyzed. But through great efforts, everything has been improved since then. But taking back to 2022, she suffered another stroke, and then she's been bedridden. And then one night she fell from the stool, and then she had just crippled her bones. And from then she's been struggling. And after 2 to 3 months from to coming to Apollo, everything has been better. Like everything, there has been improvement. ठीक है ना?
The patient, Manbhuja Sunar, she's a 68-year-old lady. She comes from Shillong. She was suffering from stroke, but she had again a stroke, and then she had severe back pain following fall. And now this back pain had crippled her. She had this stroke. She was not able to mobilize herself, and with this back pain, she was completely bedridden, and she was brought to a place with great difficulty, and she was in great agony. So when we did her battery of tests, we found out that she has got diabetes, that was known from earlier, and she has got a spondylolisthesis of L5 over S1. It was myasthenia grade 2. So this spondylolisthesis was causing her pain. The thing that we can do in this case is to go for surgery, but the patient didn't want. Her medical condition was also so rigid that we could not give the surgery. So we thought about an alternative treatment. So if you see, her bones slipped, her L5 vertebra slipped over the S1 vertebra, and that slippage was the cause of her pain. So what we did was we took some medication, this is known as teriparatide. This is a special type of medicine. So she has to take it daily. From that, her bone strength increased, and the bones got united between L5 and S1. So it did the work of what we would have done in a surgery. That is known as delta fixation. That our medicine has done the same work. So we could get away without surgery. So and now the patient is quite relieved of her back pain, and slowly will encourage her to move about with some restrictions. So because her back is now fine, one of her legs and upper limb is okay on the right side. Her left side, she can use the left side little bit by little bit, and she can be mobilized out of bed. Thank you. So if you see, this is L5 vertebra, this is S1 vertebra, and you see this dark bands. These are basically gas, and if you see, this is lengthened. So this bone has fallen upon this bone. This should have been here. Now it is transferred to here. And what happens with this is there are a lot of nerves out there, and they are getting pinched, and that causes her severe pain and agony. But if you see, there's a gap there. Now you see there's no gap here. This is one. It has become this, and this has become one single bone, and that we would have done the same surgery, we would have fixed this too. So that has been that doesn't now needs to be done. Now this medicine has united this bone. Thank you. अभी नीचे जाना पड़ेगा.